Welcome to the 2019 Lower Lights Christian Health Center Open Annual Enrollment. Today we're going to be discussing the Employee Benefit Plan, which is an important part of our four-prong approach to help attract and retain employees. We believe that fair compensation with an opportunity for personal and career growth, along with effective management and an effective employee benefit plan, is a valuable way to attract and retain our best employees. Today we're going to discuss what is open enrollment. Secondly, benefit plan overview, how the enrollment process will unfold, and answer your questions and answers in this format. Every year, ERISA requires all employers to offer their employees the opportunity to reselect their benefits for the upcoming year. The benefits you make during this period will remain in effect for the next 12 months unless you have a qualifying event. A list of the qualifying events are listed here so that you can keep track of this during the year. You have 30 days from the qualifying event to notify human resources that you'd like to make a change. Who is eligible for benefits? If you work 25 hours or more, the benefits you elect will start the first of the month following 30 days from the date of hire. Spouses that are legally married are eligible to participate, and children up to the age of 26, provided their biological, legally adopted stepchildren or under a support order, are also eligible for benefits. If an employee has an addition of a spouse or children during the year, that qualifying event, as we discussed. It's important to note and understand how you can best maximize your benefits under the benefit plan. Certain facilities, certain providers are what's known as preferred providers and provide you the best value for your benefits. Urgent facilities and emergency rooms are usually covered regardless in case of an emergency. So make sure you understand this slide so you can understand the best way to maximize your benefits. There are many things that determine the cost of benefits, especially the medical costs in the plan, and they're shown on the slide here. State and federal regulations usually add about 5 to 7% to the cost of benefits, high utilization benefits, unhealthy lifestyles, plan designs, new drugs and technologies, and aging population. We at Lower Lights are attempting to do everything we can do to save money and have the most cost-effective benefit plan available. We will also ask for the cooperation of our employees to help us keep the cost down in different ways as it relates to wellness. This slide illustrates how you as an employee can help us keep the cost down. Getting a flu shot every year, use an urgent care versus a clinic or any emergency room, or better yet, maybe in your primary care physician. Utilize carrier discounts. Make sure you see in-network providers and check before you make an appointment. Use generic RX when available. Get annual medical and dental checkups, and use pre-tax dollars through an HSA. One of the most popular elements of the Affordable Care Act is the 100% protection that all participants get for wellness exams. As you can see on this slide here, there are many different wellness exams and screenings that are available at no cost to our employees and their dependents. It's very important that we get these done on an age-specific basis when they're due on a regular basis. It's important to be under the care of a doctor, so one of the things that we do encourage all of our employees to do is to maintain a relationship with a primary care physician. So let's take a look first at our medical and prescription benefits that are available to our employees that work 25 hours or more. So let's first understand a few of the definitions that you'll need to know when you're navigating your medical and RX plan here at Lower Lights. First, we're going to start with a copay. Usually the copay is the first dollars that you spent, maybe called an encounter fee. You go see the doctor and you're asked to pay $25 or $50, and the rest is paid by Lower Lights. Urgent care might be $75, or emergency room might be $200, and prescriptions might be $10, $20, or $30. That's called a copay. Second part is your deductible. after you pay the copay and their money is due above and beyond maybe what the doctor charges, testing, things like that, you're going to be asked to pay dollar for a certain amount. After that, the expenses are shared in called co-insurance. Typically, a co-insurance rate might be 80 or 50-50, which we'll discuss later. Out-of-pocket maximum is a maximum that you can pay from all copay, deductible, and coinsurance, whether it be medical or RX. And we go over that in very shortly. And finally, network providers. There is a different deductible and copay schedule and maximum out-of-pocket schedule for in-network and out-of-network providers. As I mentioned earlier, make sure you always go in-network. Here's an overview of our medical and RX plan. You'll notice we just offer one medical plan with United Healthcare. We're going to review in-network benefits first. First of all, an employee has a $5,000 deductible, which is usually the money that you spend after your encounter fees. So as I mentioned before, if you go to the bottom, you'll see RX copays, and above that, you'll see the emergency room copays, urgent care copays, specialist and primary care office visit copays. These are the first dollars you pay when you encounter a physician or a service, and after that is your deductible. What Lower Lights is designed to do is to offer the employees access to a health reimbursement account, or HRA. Although the HRA does not fund any of these copays, once those are paid and you have to go into your pocket for extra money, usually the big money, Lower Lights will pay up to $3,500 to help you cover the. So let's take the example of a normal arthroscopic knee repair that costs $5,500. The employee would have already paid some encounter fees to see the doctor and so on, but now the surgery has been done and there's a $5,500 total bill. The employee will pay the first $1,500 of that, leaving a $4,000 balance due to the provider. As we mentioned, Lower Lights has a $3,500 reimbursement that will be paid to the employee, which they will then forward on to the provider. This creates a balance of $500, which under our plan is shared 20% by the employee and 80% by carrier. So in this example, the employee's total responsibility would be $1,600. Moving on to a knee replacement, much more expensive, of $32,000. Again, the employee pays the first $1,500, and then the $3,500 comes in, which creates a $27,000 balance. That 20% would be another $5,400, creating a maximum out of pocket of $3,650. So in this example, where the employee had a total of $32,000 of expenses, they're only going to pay $3,650, and that's due part from the $3,500. United Healthcare, our insurance carrier, has a very robust online service that can help you navigate the complexities of your benefit plan. In there, you can ask questions through Ally. You can actually download an app to keep your card and important information on your phone. Learn more about that through myuhc.com and establish a connection so you can get most out of benefit plan. As we mentioned, there are some things we're going to ask our employees to do to help us keep the cost down. And staying well and being well and seeing a doctor are some important elements of that. So to make it easier, UHC has provided the Rally Age program that is a combination of putting in your medical history and your health risk assessment to get some rewards. For more information on that, go to myuhc.com and as we mentioned earlier, it's very important for you to see in-network providers. But how do you find an in-network provider? Go to myuhc.com, or you can call the 800 number on the back of your card. Either way, you can look up providers, look up primary care physicians, doctors, dermatologists, whatever your service is needed, it would be on there, and it'll tell you whether that doctor is in-network or out of network. As an added value, Lower Lights has added the Care 24 option to our benefit plan. Essentially, this is a nurse hotline that you can call anytime to get help with minor illnesses, medical safety, medication safety, stress and anxiety, coping with grief and loss, just all sorts of personal financial information. It's an EAP that's available for you at any time, 24/7. It's important for you to understand this. Once you are a new hire or you enroll during open enrollment for the first time, keep your eye out for the cards that will come in the mail. It'll usually be mailed to you within 30 days. It'll include benefit information on your benefits. Also, it'll give you instructions on how to enroll online for the first time through UHC. It's important whenever you receive anything from our medical care or United Healthcare, you open it and read it. Many times they will reach out to you to help you navigate certain medications, certain procedures to help you get the best value. Of course, Lower Lights didn't stop at just a medical plan. As we mentioned, we feel a comprehensive benefit plan is in the best interest of both our employees and our employer so we can attract and retain the best employees. So let's go over the dental vision. As you can see, we have a dental plan through Lincoln Financial. The dental plan has a $50 deductible with a maximum benefit of $1,000 a year. Preventative and basic services are covered at 100%, major and orthodontia at 60 and 50%, and there's a $1,500 annual coverage for orthodontia. You can see this is very affordable because Lower Lights is paying a substantial portion of the premium. Employees only have to pay $2.13 per pay to enroll in this plan for single coverage. The vision plan is also with Lincoln Financial, and you can go to many retail and doctors to get a vision exam and also get lenses and frames. It's all laid out on this slide here, and you can see again, due to the fact that Lower Lights is paying a substantial portion of this, employees only have to pay 32 cents per pay to get a quality vision plan. This is a tremendous. We at Lower Lights feel it's very important to provide at least a basic life insurance benefit for all of our employees. This is 100% paid by Lower Lights, and we'll pay $20,000 or 1 times your salary, whichever is greater, in the unlikely event that one of our employees passes away. We think this is very important, but we need from you a list of who you would like to declare as your benefit. We at Lower Lights also understand that $20,000 may not satisfy all your insurance needs, so employees can buy up to 5 times their annual salary with a guarantee issue amount of $150,000. This means regardless of your medical history or medical situation, we're going to be able to issue you coverage at a standard rate with no surcharge. Very important that you take a deep look at this because your guarantee issue is only available when you are a new hire. Later on, if you were to enroll in this benefit, you would have to prove evidence of insurability. Again, in keeping with the goal of having the most comprehensive benefit plan available, Lower Lights also offers a short-term and long-term disability plan 100% paid for by the company. We pay 60% of your pay up to a maximum benefit of $1,000 a week for 13 weeks after a 7-day waiting period for accident or sickness on the short-term disability. And after those 13 weeks, our long-term disability plan will kick in and will cover up to 60% of your pay on a monthly basis up to $5,000. Again, a very generous benefit designed to attract and retain. We at Lower Lights understand that many of our employees' lives revolve around their pets. Their dogs or cats are important parts of their family. We have offered a group discounted program through Nationwide Insurance to help you cover the costs of pet insurance. Strongly suggest you take a look at this program if you have a pet, because the cost of health insurance or health cost of a pet can be financially crippling for our employees. We wouldn't want that to happen. Finally, through our consultant, USI, we have the Benefit Resource Center. This is a one-stop place where you can call and ask any of your questions that come up during the year or during open enrollment. Your 800 number will be on your card that we distribute in your open enrollment materials, and this is a service we really hope you'll take advantage of. The professionals at USI can help navigate through the different programs and help you get the most out of your benefits. Please call you. Thank you for attending this short overview of the benefits. We at Lower Lights hope that you understand how important you are to the success of our organization, and we feel our investment in these benefits is a good way to get there. If you have any questions, please call the Benefit Resource Center or refer to Human Resources. Thank you and have a great day.